Medicare for All, often called M4A, is a dream for some and pure fantasy to others. But the vision is hard to disagree with. Here it is. Everyone, all Americans, would have healthcare coverage, including dental, vision, hearing benefits, zero copays, no premiums, no deductibles, no annual or lifetime limits, no surprise bills from insurance companies, coverage from birth to death. Healthcare would be a right, not a privilege. Nice. Then comes the hard part, the cost.
29 million Americans still have zero health insurance.
Senator Bernie Sanders, Medicare for All's leading proponent, says the federal government would cover it. Just use tax dollars. Sanders floats a few options out there, including a 7.5% income-based premium paid by employers, revenue raised $3.9 trillion over 10 years, a 4% income-based premium paid by households, revenue raised $3.5 trillion over 10 years. He also wants to raise taxes on higher-earning Americans in a few ways, including their income, capital gains, limiting tax deductions. That would add $1.8 trillion over a decade. Okay, but here's the issue. If implemented, M4A would approximately add $32.6 trillion to the federal budget over its first decade, according to a study out of George Mason University. Even doubling all projected federal, individual, plus corporate income tax collections would not cover the cost. The George Mason researcher says his estimates are actually conservative because they assume that the legislation would achieve Sanders' savings goals. That would reduce payments to health providers, lower drug prices, cut administrative costs. Sanders, in response, noted that the research center at George Mason is tied to the Koch brothers, who oppose M4A. To hammer out the final details, Sanders has called for a vigorous debate. Some math will definitely probably be involved in that too. One thing's for sure, the idea is not going anywhere anytime soon. M4A has the support of about half of Americans and several leading Democrats.